From Long Beach Memorial Todd Cancer Center, we have Dr. Vora, and he is going to be talking about cancer screening tests. He'll be discussing all of those tests during COVID-19 and the serious consequences that have occurred this year. Dr. Vora is a board-certified hematologist, a medical oncologist, and hospice and palliative care, and specializes in that medicine, and serves as a medical director at MemorialCare Todd Cancer Institute, Long Beach Memorial Medical Center. He's a generalist with a specialized interest in lung cancer, gastrointestinal cancers, including colorectal cancer, pancreatic, gastric, and malignant disorders. So please help me welcome Dr. Vora. Thank you for being here.
My pleasure. Thanks, Nancy. Thanks for that great introduction. And I was just saying before you guys all jumped in the room that it's a bummer I can't see all of you in person. And hopefully if things go well next year when everything's opened up, I'd love to meet all of you and shake hands and hug people and things like that. As Nancy said, my name is Dr. Nilesh Vora. I am the medical director at the Todd Cancer Institute, Long Beach Medical Center. Trained over at City of Hope, where I did my fellowship. My parents are both working there, so there was a while where the three of us used to have lunch together, which was fun. And then I realized that I had to break away and find my own way, and so I came to Long Beach, where I grew up. And it's been great being part of the community and making a difference in setting up this cancer center. And we've been doing amazing things. We have been doing amazing things. And just like the rest of the world, the COVID-19 pandemic really put a wrench in all of our plans. And this points out a very important topic that I get to talk about today to all of you. And it's really the dangerous effects that the pandemic had on the diagnosis of cancer. I think all of us understood how dangerous COVID-19 was, how scary everything became, and we all realized that there was effects last year in 2020. What I want to talk about specific to oncology are all the effects that we might be dealing with later. So again, thank you for the invitation. Let me see if I can advance this slide. There we go. So the agenda for today, I think this is a good time to talk about cancer screening tests as well. We'll talk about really quickly the pros, the cons, and the challenges of cancer screening tests apart from the pandemic. Then I'll segue into what happened in 2020 with screening tests and this dangerous decline and the impact that'll have in 2021 and even beyond, not only to patients, but to healthcare providers, to hospitals, all throughout the next decade of healthcare, we're going to see this impact, it is likely to say. And then I'll talk about what our call to action could be from a healthcare perspective and from you, the community point of view. What do we need to do to try and reverse the trend that was happening? So, background, cancer screening tests. We've come to realize with evidence that cancer screening tests are extremely important. The pros, it gives us an opportunity to detect precancerous lesions in cancers at their earliest stages. It gives us the opportunity to treat cancer before symptoms occur. And I think most importantly, it gives us the opportunity to cure patients from these cancers that are most likely, if left alone, would become fatal diseases. And so that really becomes how essential cancer screening tests are. There are concerns, and I share these concerns. People have come to me and said, why don't we just make a PET scan every year, a screening test? Or, my aging grandfather is 95. Should we check for prostate cancer? There are concerns with screening tests. Number one, do we detect cancers that are called indolent, cancers that don't truly become a threat to life, such as prostate cancer in some patients? The other concern is overdiagnosis. Do we do these screening tests and we find out that we get a false positive nodule in one's lung, and then that leads to a biopsy, and that leads to anxiety that might become unnecessary when this doesn't become cancer. So I understand the concerns with screening tests. And I think it's also important to talk about why patients avoided cancer screening. I'd often have conversations with patients when they're diagnosed with cancer and they're 65, they'd never had a colonoscopy before, for example, or they're a smoker, but now with lung cancer and they never had a CT scan looking for lung cancer. And the reasons that people avoid cancer screening tests include the idea of denial. So the idea that the screening test really has low value because they say to me, I felt fine. I didn't have any symptoms. I didn't have any weight loss. I didn't think I could have cancer. Well, the problem is sometimes you have cancer and you don't have those symptoms. There are practical barriers. For example, making time to get your mammogram or colonoscopy done, which then delays things because you just skip a year. There's patient misunderstanding. So oftentimes they're not told that it's important to get a mammogram once a year or a colonoscopy every 5 years if there was an abnormality found on one before. And so oftentimes patients don't understand how often they're supposed to get screened. And then I think it's important to mention that there are cultural barriers. There are many, many cultures that I've seen where you only go see a doctor if you're feeling poorly, that there is no reason to do preventative medicine if you feel healthy. And I think those became challenges that we were, even before the pandemic hit, that we were facing, is trying to get more patients to get their screening tests on time and to follow up with their physician. Just as a review, these are some of the screening guidelines for different types of cancer. So breast cancer, you see many different societies that have an opinion on when mammograms should start. And for the most part, the recommendation is women aged 40 should start with yearly mammograms as they move across. These are just reviews. This is what the U.S. Preventative Service Task Force made as their final recommendation statement regarding screening for colorectal cancer. And it was just last year that the USPTF said that colon cancer screening with colonoscopy should start at the age of 45 and not at the age of 50, as we had made a rule, previous to that. And the reason why is because of this data here that says that in adults aged 40 to 49, the incidence of colon cancer increased by about 15%. So it was enough for the task force to say we should start screening at the age of 45. And then this is interesting to me, lung cancer screening. So again, this is the U.S. Preventative Service Task Force in 2021. And this is based on really good data, the National Lung Cancer Screening Test, which took patients with this population. So if you're aged 50 to 80 and you have a 20-pack year smoking history and either are currently smoking or have quit within the past 15 years, you are eligible for a low-dose CT scan once per year. And what's interesting that is if you look at the data, it showed that we were able to save the life of 1 out of 5 patients who fit this criteria from lung cancer death. This is dramatic to me. That is more effective if you look at it from a data perspective than mammograms are or colonoscopies are. And yet there are so many patients that I've met who are diagnosed with lung cancer who were never recommended to have a CT scan for lung cancer screening. So I think, I wanted to take these last 3 slides just to re-educate the importance of cancer screening and to talk about what the guidelines recommend from these important task forces. So as we move forward with that in mind, now I come upon a different problem, which is the impact that the COVID pandemic had on cancer screening. So as you can imagine, we were all here in 2020 and it was March, and all of a sudden we went into a full shutdown. And I'll admit, we had meetings at my own institution where we said, what should we still do for patients and what should we put on hold? And there were some chemotherapies that we said we can wait for a little while to see what the pandemic does. And there were iron infusions and things like that. Well, cancer screenings dropped dramatically. And you can see that based on this data here, which showed that in this particular data set between January and April of 2020, colonoscopies and mammograms went down by nearly 90%. And almost 90% of these tests weren't done during the time period of 2020 that I'm showing. This is another set of data. This is 60 different healthcare organizations who submitted their data. And it shows that, and it shows that the estimated cancer screening tests in this purple line, which is 2020, during the weeks 10 and 20, for breast cancer, colon cancer, and cervical cancer dramatically decreased. And when you look at these numbers, we're talking about numbers about 60% or so. So again, what I'm really showing is the effects that the pandemic had on these screenings. And so you have to stop for a minute and look at this data and think about what the impact would be. And the NCI did this. The NCI researchers, National Cancer Institute researchers, raised concerns that this pandemic would delay the diagnosis and treatment of some cancers, and that would potentially cause serious consequences. And I would say that these missed cancers, and you have to think about it this way, when they eventually get found, might be larger and more advanced when they're ultimately detected, as opposed to when they could be detected from these screening tests. Dr. Vora agreed with this thought, and he said, from the NCI, he said, this is a complicated story that will reveal itself slowly over time. And I have to agree, I don't know what the full impact is going to be on this, but I think we will figure this out when we look at survival curves later in years to come. So this is data on the diagnosis of new cancers. So I talked about how many screening tests were missed. This is actually data that shows different types of cancers and how many fewer cancers were diagnosed. And so as you can see, from January to April of 2020, you know, we diagnosed almost 50% less of various types of cancers during that year. And again, this leads to my point. These cancers are not going to go away, and they're not going to just stop growing. These cancers that should have been diagnosed are going to appear later, and that appearance will be at advanced stages, which means that we might have survival impact later. This is more data that kind of talks about this as well. This comes from the Mass General, MGH in Boston. And they show in this first two columns, how many patients they screened for cancer, over 60,000. And of those screening tests, these were the percentage of tests that came back positive for cancer, about 5%. Well, during the start of the pandemic, from March to June of 2020, there's dramatically less patients being screened. And you can imagine that the people getting screened are the people who were at high risk for developing cancer. And that shows because the cancer diagnosis rate went up dramatically from about 5% as they would expect to 12%, a overall increase in positive diagnosis by 140%. And you have to think about the impact this has on healthcare. All of a sudden, there's a lot more cancers to talk about at your tumor board. There's a lot more cancers that need treatment urgently in the hospital, surgery or radiation or chemotherapy. And I don't know that we had the space for that all at the same time. I don't know that the world was ready for all of those cancers to be diagnosed at that time. So it was a tough time. And again, the impact is going to be felt. This was an interesting study. This was done through the Kaiser system here in California. And in this Kaiser system, what they did is they presented all the patients in 2020 that were diagnosed with breast cancer. And they compared those patients with patients who were diagnosed with breast cancer in 2019. And I'm sorry for all the words on this slide, but I'll point out the important parts. that the patients in 2020 who were diagnosed with breast cancer presented with more symptomatic disease, they presented with more advanced disease, they presented with positive lymph nodes, and there were more patients presenting with metastatic disease. Not to mention, many of these patients had more aggressive types of disease. And so this proves the point that we're going to see patients with more advanced, more scarier tumors because of what happened during the pandemic. Dr. Tang said, as screening mammography rates return to pre-pandemic levels, our system must prepare for a likely surge of new breast cancer diagnoses. We will continue to monitor breast cancer screening rates, breast cancer diagnosis, and treatment trends for future research. So this is a complicated story that will reveal itself over time as we get more and more data. This is an important story. So this was a patient, 60 years old. In the winter of 2019, he had rectal bleeding. He assumed he had hemorrhoids. He heard at that time that patients were getting COVID and the hospitals were overwhelmed. And so he deferred seeing his doctor. In March of 2020, so about 3 months later, he had bloody streaks in his stool. Didn't have any abdominal pain. He went to the emergency room, I should say. And because he didn't have an abdominal pain, the ER was overloaded. They deferred doing a CT scan at the time and said, instead, let's just get you to see a GI specialist because COVID is amongst us. In spring of 2020, he tried to schedule the GI appointment for his colonoscopy, but he was unable to do so. We saw this, as a huge problem back in 2020. GI doctors weren't doing elective, quote unquote, colonoscopies. His stool was changing, blood was more extensive, and he was losing weight. In June of 2020, he felt focal arm weakness. So his arm felt a little bit weak. He took some over-the-counter medications, and that went away. And so again, he didn't think anything of it and kept going. A month later, in July of 2020, he went back to the emergency room because he had facial numbness and a headache. Finally got that CT scan, and it showed that he had a big mass in his rectum. It had spread to The scan showed that this tumor had spread to abdominal lymph nodes, his bones, his pelvis, his spine. He had metastases in his skull base. He had lymph nodes in his chest, and he had a big pulmonary.
Oh my gosh. Oh.
And he had a big blood clot in his chest. So it was finally August of 2020 when he was diagnosed with metastatic colon cancer. And so you look at this timeline and you shake your head. This is what we saw. And you have to ask yourself, what impact will this have? How do you approach this patient and his family? This patient tried what he could do to get his issues assessed. I think the other thing we have to point out is you have to point out what impact this will have on healthcare workers. So as an oncologist, with my nurse practitioners at the Cancer Institute, we will have more conversations with patients about stage 3 and stage 4 disease and the psychological impact that has. And those are tough days for us. Those are days that lead to things like burnout and troubles. And so I think there's an impact not only on patients, but also on healthcare workers. And then I think it's also important to understand that there's a financial impact to this, that we will see more later and later diagnoses and more patients will be hospitalized when they may have avoided being hospitalized if they were diagnosed earlier. Because we know at the end of life is when financial impacts are felt the greatest in oncology care. So I think this needs to be talked about because this is very real and a very real consequence of the pandemic. So I have a couple summary slides. As a result of the COVID pandemic, screenings, which we've acknowledged are extremely important, were suspended. As a result of that, diagnoses were delayed. And then eventually when cancer was diagnosed, it was diagnosed at a later stage, stages 3s and 4s instead of 1s and 2s, for example. treatment is impacted and will be impacted. And the question is, what influence will this have on overall survival? And I think that's important to talk about and think about. And this was a quote that hit me and struck me. Cancer screening and diagnosis needs to continue to play an important role in our standard healthcare measures. Without going back to pre-COVID screening numbers, our cancer diagnosis and mortality rates could revert to numbers seen many years ago without the benefit of our current technological advances. We could be moving backwards because of all of these issues that have happened as a result of the pandemic. And I think that's where the call to action needs to happen. And so this is where I appeal to all of you, and I say, what can we do to help reverse this disturbing trend? So this is a beautiful picture of our pavilion. I can talk about the things that we're doing. Number one, our screening testing centers are opened, we are safe, and we are educating our providers of the dangers of these delayed diagnoses, and going back to telling everybody again, hey, screening tests are important. We need to get people back into our breast centers, back into the GI labs, back to their primary care providers, and getting those tests done that were obviously not done during 2020 in the majority of patients. And then it's a call out to all of you. So it's urging our community to become vaccinated so you can avoid being hospitalized, which I'm grateful to see is happening for many, many people and patients. And then most importantly, to resume cancer screening. So it's telling all of you to make sure that you're back on task with your mammograms, your colonoscopies. If you have a history of smoking, with your lung cancer screen tests, labs for prostate cancer screening, all of those things need to resume because we probably missed them or delayed them last year. So there was a really, this topic was the subject on the Today Show in May of 2021.
At the height of the pandemic, hospitals were overwhelmed by COVID-19. Appointments for regular health screenings and tests canceled as a result, with potentially devastating effects for years to come.
The effect this pandemic will have will cover the next 10 years. Patients catching up on their diagnoses that we've missed.
According to one study, during the first few months of the pandemic, an estimated 41% of adults missed getting medical care. 63% of those surveyed responding that their designated medical practice was closed either temporarily or permanently.
In the beginning, we wanted to minimize contact with patients. Limiting visits in the office or in the hospitals became kind of a priority.
Yvette Lowry knew she was at risk for breast cancer, but like so many other patients, her March 2020 mammogram appointment was canceled due to COVID.
It was like a setback for me.
5 months later, in August, Yvette says she felt 2 lumps near her breast. When she called to see her doctor, the mother of 2 says that due to the COVID-related backlog, the first available appointment wasn't until October.
That's how booked up they were.
How did you get up every morning knowing you had these lumps, knowing that you had to wait?
Every day I couldn't sleep. I didn't want to eat. I didn't want my kids to worry.
Yvette was eventually diagnosed with stage 2 breast cancer, verging on stage 3.
So I don't think we know the full magnitude of delaying cancer screenings just yet. What this may result in is more the need for additional therapies, such as chemotherapy and radiation therapy, and lower cure rates.
And potentially lives will be lost because of this as well.
That's exactly right. And that's the biggest backlash, which we may not see for years to come.
Many other appointments were canceled by patients worried about catching COVID-19. A February 2021 Time Harris poll shows at least 78% reported putting off at least one medical service, with patients skipping dental appointments, annual checkups, and eye exams.
And I'm like, well, these are just annual checkups. So I just skipped it for a whole year. I was pretty fearful of going to any medical place.
Earlier this year, volleyball coach Sherry Sanders was in extreme abdominal pain. Because some of her family members were considered high risk for the virus, she says she avoided going to the doctor for treatment until the pain became too much.
Were you scared of COVID-19 when you were in urgent care?
Oh, yes. I'm being potentially exposed to all these people who probably have been exposed to coronavirus or are sick. and getting tested. And I just want the heck out of there.
When a doctor finally saw her, she palpated her abdomen and immediately found a large mass. Sherry was eventually diagnosed with stage 2 cancer of the appendix.
I was probably weeks away from being stage 3 or worse.
Experts now warning, if like Sherry, you've missed your health screenings, now's the time to see a doctor.
This absolutely touches every bit of healthcare. We're talking about cardiovascular systems, we're talking about standard internal medicine problems, and we're talking about oncology issues. Yes, it's all across medicine.
And what is your advice to a patient?
To be diligent, to see your physician. Things are different now. The majority of healthcare workers are vaccinated. Offices are safer. Things are much better than they were.
For today, Erin McLaughlin, NBC News, Los Angeles.
Well, listen, I was going to put off my annual checkup, decided, back in September, let me just get this done.
Yeah.
And if I hadn't, would not have detected the prostate cancer, which was very aggressive. Maybe 3-4 months. My outlook and outcome might have been completely different. So I cannot stress enough to people: go out there, get your checkup, make sure you get checked.
There's a cautionary tale.
Yeah.
There's enough of a reason to do it right now. You're good now, though, right?
Yeah, actually, just had my 6 months checkup. The PSA undetectable.
Okay,
so,
great.
Keep knock on wood.
He'll live another 30 years.
That's right.
In conclusion, and I definitely want to give ample time for questions or comments. The COVID pandemic in 2020 has affected healthcare, obviously, in countless ways. One of the most impacted areas in oncology include missed screening tests and delayed diagnoses. And that impact will be felt for years and years to come. But it must be priority, once again, as we move forward in 2021, to place the emphasis on preventative care in medicine, to prioritize cancer screening tests, to go out and get on your screening test as you're supposed to have it back on time, to tell your friends, tell your family members, to really emphasize how important this could be. So I thank you for your attention. I can't go on further without thanking all of the people who make everything so great at the Todd Cancer Center in Long Beach.
Thank you so much for being here, for spending your time this evening to help educate all of us. And we hope to have you back soon. I know Randall has been instrumental in helping to line up some doctors to come speak to our community and really highlight all the great work that you all are doing over at the Todd Cancer Pavilion. So I think what we'll do is say good night